addiction, prevention, recovery.
Welcome to the Recovery Rebirth Podcast.
Welcome to the Recovery Rebirth Podcast. I'm Dominic.
And I'm Jillian.
Today's topic is going to be dealing with health issues, kind of a bonus episode. We're releasing this right after we talked about dealing with health issues, but it's kind of a follow-up. Mm-hmm. Jillian, you had your surgery that you were talking about, so how did that go?
Well, for a minute I didn't think it was going to happen. When I got to pre-op, I managed to get myself so worked up that my heart rate was up to 150. So,
oh boy.
And I slept fine the night before because, as you know, and we talked about, I was having some anxiety leading up to, but I managed to get myself to a pretty good place. I thought, I had to be there like 5:30 in the morning for 7:30 surgery. So I get in there and I'm a pretty good rule follower, but apparently I had drank water too close to the surgery time, and I didn't know that, so they had to delay it a little bit. But yeah, when the anesthesiologist came in, he's like, "Whoa, what's got you all amped up or something?" I'm like, "I'm freaking nervous, obviously. Like, I'm anxious. I never had a major surgery."
What's got you amped up? Well, you're about to cut my body open.
Exactly. Yeah, like you're about to put me under, which kind of scares me. And so when my sweet daughter was in there with me, and I couldn't see, thankfully, because the display was behind me on the wall. I couldn't see what my heart rate was. But then when they said it, I'm like, oh my gosh. And then my daughter's like, okay, it's coming down. It's like 130, whatever. And, the anesthesiologist was nervous about doing the procedure with my heart rate being that high. So I got myself down to like 115, which is still, fast, but better. And they gave me the magical Versed, which I'm very anti-medication. I'll barely take an acetaminophen unless I have to. But in that moment, it was necessary. So they gave me a little infusion of Versed in my IV. And I'm like, how are you feeling? I'm like, I feel wonderful. And next thing I know, I'm being rolled into the OR, a few words from the surgeon. They put a mask on my face and I'm waking up. So, I think the build up to it, the anxiety was the hardest part. And, as I tell other people when I'm, encouraging them on this forum that I'm on, everybody in that OR wants the best possible outcome for you. So I tried to remember that. But as we know, because we've talked about it, fear and anxiety many times in this podcast, when your amygdala is, on overdrive, it's hard to access that rational part of yourself. So the surgery apparently it went 80 minutes, which is less time than I expected, but they did have to cut me open, which wasn't the plan. I was expecting like just some laparoscopic incisions, but we talked about that fibroid, that typically benign cancerous mass, or benign mass, not cancerous. Benign mass that women just grow. Turns out I had 8 of them. I only knew about 1 of them. But they're very dense and difficult. And so in the end, I had to get cut open. And now I have a new appreciation and compassion for people who have had C-sections, because that I never realized how much I use those very lower abdominal muscles. So
we take all of that for granted, don't we?
Yeah. Trying to get out of bed or off the couch. It was just, those first few days were pretty rough, and my abdomen looked like a war zone. And I was terrified to sneeze, cough, laugh, or even like crying, even like a gentle cry. I got some lovely flowers from my coworkers, and that triggered a little bit of gratitude and some grateful tears. And I'm like, ouch, it hurts. So I tried so hard not to do those things. But
you recuperated fairly quickly, didn't you?
By the 2-week mark, I was feeling pretty normal-ish. And by 3 weeks, pretty good. And then this week, I noticed some more like internal pain. Just like not constant pain, but I'm still healing. I think, and you can't see what's going on inside. So I had my follow-up appointment. And that's when I discovered, that I had these extra fibroids, the bonus fibroids, a family of fibroids, if you will. And she explained, why it was necessary to do it that way. So I go for another follow-up in a couple weeks and back to work. Next week is my last week off. So
So you're healing and cured.
Well, yeah, ideally. And the good news is when I get my pathology, I was pretty sure it was okay. But to read that, everything benign was it was really nice to have that validation. And my sweet daughter came to stay with me. It was going to be 2 weeks. It wound up being 3. And I cannot tell you what a blessing that was. Like that was, she's those first few days, I'm sure I was, she's so patient. And then just having her presence, even after I was physically starting to feel better, that was the best part of it. So I'm glad to be on the other side of it. But also, unfortunately, since my surgery, you've developed a really uncomfortable, downright painful, just miserable health condition yourself. And it sounds worse than my recovery from surgery, and I'm really sorry to hear that.
Well, thank you for bringing that up.
Yeah.
Because I wanted to talk about a little bit about that today.
Yeah.
I basically, beginning of March, I had a lot of work stuff going on, and I was producing a fundraiser, and I had a lot of stress, and like the day after, I started feeling incredibly achy and sore, and I was like, something's weird, something's wrong, and this is a high level of pain that I'm not used to. And I had some itching on my back, so I got out the old back scratcher and scratched it, which probably wasn't a good idea.
Yeah.
So, but then I looked, and there was some kind of a rash developing. And I'm like, what's going on? So if you've ever had chicken pox in your life, you have the virus in your system for shingles.
Yep.
And it's not just an old people's disease like I thought it was. I thought old people get shingles. Younger people don't get shingles. You have
My
to
daughter
be
had
elderly.
it. Yeah, as a freshman in high school.
Well, I've learned an awful lot about shingles in the last several weeks, close to a month.
Yeah.
And apparently people have gotten it in their 20s and 30s, and but you certainly are at higher risk when you're over 50. And as I sit here today recording this podcast, I have been dealing with chronic pain because shingles is not only a rash on your skin, but it affects your central nervous system.
Yep.
And the pain is close to unbearable after a period of time. It's just, I equate it to being a burn victim.
Yeah.
If your skin were burned, it would affect your skin and your nerves under your skin. And I've never been a burn victim, so I don't know what it feels like, but that's the only thing I could compare it to.
Right.
Because people are asking, what's going on? How do you feel? And the rash. And the rash is not the big deal. The rash doesn't hurt that bad. It's the nerves underneath that, the rash is itchy a bit and stuff like that. But I never would have thought in a million years that I would have this. And I certainly would encourage anybody who is offered the shingles vaccine to take it, because even if you get shingles after you get the vaccine, because the vaccine doesn't promise a total immunity, but it promises a less prominent episode.
Less acute case. Well, and the timing of you getting this was like, I just turned 50 a couple weeks ago, anyhow, and I was like, do I need to get that? And then I'm like, the universe is telling me quite loudly that, see your friend having this absolutely miserable, like, I wouldn't trade places, like, it would be easier, I think, for you to go through what I went through. It definitely sounds like I had some pain for a little bit, but, then my body started to physically heal from the surgery, and gradually I was feeling better. But for you, you've had kind of this unrelenting just pain, and it's not like you can't put like Caladryl on this or take Benadryl, or you can't treat it like poison ivy. I mean, or even, I don't know, chickenpox. It's been a while, but that, I feel like chickenpox doesn't last as long. Like, this has been a month. And what have you been able to do for pain and discomfort managing that?
Well, the first thing is, and I mentioned this in the previous episode, I went to the doctor. As a person in long-term recovery, I am honest and open with my doctors about everything in my medical history, including my recovery. And I went to the doctor, and in the beginning, because I'm like, I've got this rash, and we need to confirm what it is and look at treatments. And that was like right after I noticed the rash wrapping around my side from my back and coming to my chest.
Mm-hmm.
And the doc said, you definitely have shingles. That's what it is.
Okay.
And they put me on 1 week's worth of antiviral medication.
Okay.
And I asked if there were any creams or anything to numb the area. It was very uncomfortable, painful, and so forth. And at that point, they said, no, well, really, there's nothing we'd recommend at this point. We got to let it run its course. Yeah. So I went home, and let's say I've lost like 5 pounds, which I'm a pretty slim person already, and I don't need to lose weight. Because I haven't been as hungry. My appetite's been affected. My work's been affected. My sleep has been affected. My recovery has been affected because I haven't been able to go to as many meetings, so my mood is, not the best. And I would honestly say this is the closest I've ever come to thinking about drinking in 18 years. I mean, I suffered with this through close to a month. So we figured out my CIA torture breaking point.
Right.
I would be giving up every national secret there is. I'd be like, "What do you want to know? Right. You want the nuclear codes? Here, you can have them."
Oh
I would be giving all that up if this were a form of torture. 30 days is my breaking point. So
wow, a lot better than a lot of people.
So I went through 30 days of pain, and I couldn't take it anymore. I went back to the doctor. And I said, I'm at my breaking point. I said, I once again explained that I'm a person in long-term recovery, and this is the closest I've thought of drinking. The next stop is a bottle of tequila.
Yeah.
So they took me very seriously, and we talked through it, and the doctor was very receptive. I mean, usually you get a 10-minute appointment, in, out, here you go, have a nice day. This doctor took over an hour with me.
Wow.
And we talked through different options. And where I go, it's a teaching medicine operation. So there's doctors teaching doctors. And so a team of people looked at my case, and they decided that gabapentin was going to be used. Gabapentin is an anticonvulsant. It's actually given oftentimes to an alcoholic showing up at the emergency room presenting for alcoholism, and they're trying to detox the person. Or at treatment centers, when they're detoxing a person, they give you what's called Neurontin, which is a name for gabapentin.
Okay.
So gabapentin is supposed to work on the nerves. So it's going to be better than, let's say, an opioid pain medicine, which would just mask the symptoms and not get to the root.
Right.
We want to try to fix the nerves and let them heal. Because if you don't know anything about shingles, it's a rash that affects your nervous system. So my nerves are going nuts. They're just like it's like electrical shocks going through my system, and zapping of pain and stabbing of pain, and it's woken me up in the middle of the night. It's been awful.
The closest thing, because we chatted about this, I had a pinched nerve a couple of years ago in my lower back, and it was it's the only thing I can think of that might come close possibly, but it's not even comparable. And that would just be like a shooting sudden pain, and I would seize up, and then it would go away. But that was that was a localized area of my body. Like the fact that you have gotten through this without resorting to a bottle of tequila is a huge testament to your recovery, I think, because that's a lot of physical pain for a sustained period. And the fact that it's just you just got to wait it out. There's no topical thing is going to help, because your epidermis, like your skin, it's underneath that. It's the nerves. So even if you treated the rash that might be itchy, once that's gone, you still have the nerves.
Yeah, and I talked to them about getting a nerve block, and nerve blocks only last for 72 hours at best, if you're lucky.
Yes.
So, that's not a long-term fix. And thank you for the compliment about a testimony to my recovery. Because
seriously, though,
if people are stable in recovery, you're able to go through these situations. But if you're in if I was in early recovery, I don't know about you, but I would certainly think that this is, a good time to drink or start looking for street drugs. I didn't do that, and it was only a thought. I didn't have a craving or an obsession.
Right.
But it was a thought that a bottle of tequila would fix this, and that sent me to call the doctor. So the reason I wanted to record this podcast is I sit here right now in pain. I'm in pain this moment. And I'm recording this so that if people are listening and they have to deal with chronic pain, alcohol and street drugs are not the answer. It's only going to be a temporary fix, if not a disastrous run of events. Because I know if I started drinking, I wouldn't stop, and I'd probably be dead. So I'm not going to let shingles kill me.
Right.
But I wanted people to know, go get help.
Yes.
I probably should have gone sooner to the doctor. I did hint at the fact that I was in a great deal of pain. I had been messaging back and forth over the course of the last, 30 days with doctors, telling them that I'm experiencing some pain. And finally I said, we're going to need to, we're going to need to do something that's aggressive to deal with this acute pain. And I said, I'm at level 9 right now, This is right up there with trauma type pain.
Yeah.
And they were able to work through something with me. So please get help.
Yeah.
Don't suffer alone. And thank God for my friends in recovery. I had people calling on me and checking on me and asking if I was okay. Somebody brought me food because I certainly don't feel like cooking.
Right.
Those kinds of things.
Yeah, because So I'm glad that you had sustained and long-term recovery that allowed you in that moment of crisis of like, I've been dealing with physical pain for a month now, and being honest with your healthcare provider. I mean, not only like at the outset, like I'm a person in long-term recovery, but like, hey, but I'm feeling that my sobriety is at risk. I'm in so much pain. We need to elevate this. And that
I did make that clear to the doc.
Yeah. And I'm glad that he took that seriously. And it sucks that this is one of those scenarios where you just have to wait it out. And how many times do we have to do that in recovery? I mean, there are, and just like acceptance. Did that, was that something you had to work on? Like, I accept the fact that I hate this, that I'm in a lot of pain, but that I just have to, I'm sure you were in that one moment at a time.
Oh, definitely.
Phase of recovery.
Definitely one moment at a time. A lot of prayer.
Yeah.
Tried to meditate. It was very tough to sit still and calm my body, but I did. And I tried a bunch of natural type stuff. I'm drinking green tea. I'm taking vitamin C. L-lysine is a nutritional supplement that helps with shingles. I mean, I did all of the things that I was supposed to be doing on my own.
Yep.
I wasn't able to get to as many meetings, as in previous times, when I'm feeling good. But I checked in with people in recovery and told them where I was at and that I was in a lot of pain. And still managed to show up for some things that I had made myself responsible for. And did those things, but then I would go and crash, and sleep. And I can tell you also that the acceptance piece was a huge part of it, because I had to accept the fact that this virus needs to run its course.
Yeah.
And that means I'm going to be uncomfortable for an extended period of time. And in early recovery, discomfort is maybe more difficult to deal with, especially physical pain and discomfort and the things that come with early recovery. When you're in stable recovery, you think, why is this happening to me? I had to use the acceptance rule and say, I need to accept the fact that this is going to be unpleasant.
Yeah.
I didn't realize to what extent it was going to be unpleasant.
Yeah.
I didn't realize that, but I sure get it now.
Yeah.
And I don't know. I had to use every tool available to me.
I bet.
To be able to get to this point, and I'm still not, 100%. It's getting better slowly, but just before we started recording, you and I were chatting, Jillian, and you saw that I was like grabbing my side, and
you would just like wince, like you could just like I could see your physical reaction to these shocks and zaps, these pains that you're feeling.
Yeah,
it's awful, listeners. It's awful to see somebody in pain like that.
Yeah, it's not pleasant. And there are plenty of people who have health conditions where they need to deal with chronic pain, and I advise get in a pain management program of some kind. Talk to your doctors. If you need to go to specialists, go. Don't sit there and try to tough it out, and white knuckle it. Just like recovery, we can't tough it out.
Right.
We have to use the resources available. And I feel like I should have gone to the doctor sooner, but I was in a little too much of the acceptance part. But then it got unbearable.
Right.
I reached my breaking point.
Yeah. Well, I feel like it's step one. Admitted we were powerless over shingles. Like seriously, because we can apply that step to so many things in our lives, and that was definitely one of those for you. And it's great that you could get to acceptance with something that's so uncomfortable and so miserable, and just try to accept it. But I'm sorry that you got to that breaking point. But it's one of those with this condition. It's like when you're told like you just have to wait it out. I'm sure you're just doing your best to get through it until you got to your breaking point. But again, the win is that you didn't have a slip, you didn't relapse, because this has really tested you unlike anything in a long time.
I've never had anything like this that lasted this long. I usually deal with a lot of stress and everything on a pretty regular basis. I mean, anybody that knows me know I'm involved in a lot of different things, business-wise and socially,
and service-wise,
and in service-wise as well. So I'm go, type A personality. I'm used to stress and pressure and all that, and oftentimes thrive in it.
Sure.
And with this situation, it's been one of the biggest challenges I've been through in many years.
Yeah, the universe certainly made you slow down, whether you wanted to or not. I mean, I'm glad that you're able to fulfill the core things that you need to do for business or maybe service opportunities. But man, yeah, you're just really being forced to be with yourself and just accept and surrender. And I'm really looking forward to you being on the other side of this, because it's really hard to see, a friend being so uncomfortable. And it's feeling of powerlessness for me, because it's not like I can just hey, here's some chicken noodle soup and some cortisol like that, or that's not gonna make it go away.
No.
Hopefully you won't. This will be. I guess you can get it again. Did you tell me? But hopefully. I mean, that's a very unlucky person who gets struck with this more than once. Most of the time, from what I understand from the research, is that, it's a one and done type of thing like chicken pox. Thank goodness. But yeah, the doctors have also said that they have had reoccurrences, as you get older, or, things can happen, a lowered immune system, and you can get a reoccurrence. But I also am eligible in about a year and a half to get the shingles vaccine to try to build up a further immunity to the virus presenting itself again. But it lies dormant in your body, so you never know what's going to happen or when it's going to happen. But I watched two of my friends go through surgery. I mean, they had their bodies cut open, and they're up dancing around now and having coffee with friends and hanging out with family, and I'm sitting here with this, and I'm like, man, I need to get well. Yeah. It's pretty bad when you find yourself envious of your friends who had surgery. Like, surgery would be better. Right. But honestly, I mean, where I'm sitting, and hearing your experience, I'm like, surgery, hands down over that any day. But I feel like it's another one of those, gosh, man, this has really been a test for you. That's to be in sustained physical discomfort, and then you've got, sleep deprivation, obviously, because you can't sleep well when you're physically uncomfortable. Well, I've been woken up in the middle of the night with a jabbing, stabbing pain in my side.
Yeah, and I have sleep issues already. I mean, that could be a whole different episode on dealing with sleep. There's a lot of people who are in recovery that have sleep issues.
Definitely, yeah.
So,
but the acceptance part that you talked about, my daughter had to. It's funny, she's not in recovery. I mean, she's heard me talk about, recovery for years. But when I was going through, kind of the frustration, you're feeling like, wait a second, I have friends that went through major surgery and now they're up and around and they're able to, go have coffee with friends or do whatever. And I'm stuck home in physical discomfort, feeling miserable. I was, lamenting why did I have to get cut open, blah, blah. And the first few days my brain and body were kind of at odds because we went for a walk maybe 2 days after my surgery and I felt like I was 85 years old. I was and I'm usually a very brisk walker, and my brain was so frustrated because it knew what my body was capable of before, but my body's like, not today. And so my daughter said, maybe you just need to accept this is the surgery that you had. And I didn't want to. I was mad. I'm like, well, it is what it is. This is the surgery that I had. And here I am. And I have to recover from this version, not the version I thought I was going to.
But one thing is you knew you were going in for surgery.
Exactly.
You had planned beforehand. You'd taken the time off from work.
This
disease hit me out of the blue when I thought I was on and off and running on other things.
Yes.
I had other things to do.
Yeah.
And it just came up out of the blue, out of nowhere.
Blindsided you.
And blindsided me right after I had just done a big successful event that everybody was thrilled with.
Mm-hmm.
And then I get hit with this.
Because that was right after the comedy show, right? Okay.
It was right after I'd produced a comedy show fundraiser and
a recovery, comedy show, which I really wanted to go to, but that was 2 days after my surgery, and I probably would have ripped my stitches out going to that because laughter that was hard because I love to laugh, and I'm like, it was just painful.
No, that would have been a dangerous situation with stitches in.
Yes.
And I had just joked during the comedy show. I joked about being in good health. And
right.
maybe
and the universe was like, what was that? What'd you say, Dom?
Yeah, what'd you say?
I'm sorry.
Show you.
Say that a little louder.
So, happy birthday to me. I just celebrated my 59th birthday recently. And most of the time I feel like I'm about, 40.
Yeah.
And 39 instead of 59.
Mm-hmm.
I feel right in that range. But with this condition, I have felt like I'm, in my 80s.
Yeah.
Just because it's so debilitating to be in constant pain for this long. I talked about my back pain and when I was suffering from back pain, which, God bless, I have not had any major back episodes lately, but that's different. I mean, that lasts a week and a half, and you're back up and running.
And they can treat it better. I feel like there's a more effective treatment for that pain,
right,
compared to this.
Yeah, this is. Nerve pain is a very strange and mysterious thing that
awful.
There's not a lot that can be done. There's certain lines of treatment, and the gabapentin is one of them.
Yeah.
And we'll see how that works. But the point of all this is that there's pain management programs out there. Don't suffer alone.
Mm-hmm.
Don't wait too long to get to a doctor. I know some people just hate to go to the doctor. It's like, I should have gone sooner myself. I should have said, this is getting ugly, and I toughed it out until I hit my breaking point. And, we know where that is now, approximately a month. So, we'll put something in the resources, hopefully about maybe pain management and dealing with chronic pain.
Mm-hmm.
We'll find some resources for you in there. I'm just grateful that I have a program of recovery that has been there for me, that kept me, from losing it totally.
Yeah.
In this instance, because if I wasn't in recovery, I could very well be dead right now from alcohol poisoning.
Absolutely.
Or doing drugs. I mean. People running out and trying to get some heroin and they're laced with fentanyl and they're dead on one dose.
Yeah.
That's the kind of stuff that happens when people don't get the proper help.
Yes.
getting the proper help and working with your doctors. And I don't know what it is about today's medicine, Jillian, but you got to push the doctors a little bit.
Yeah.
You can't just go in and expect them to be Columbo and figure out everything about you.
Yeah.
It's not like it used to be 30, 40 years ago where your doctor would just take a look at the whole person and there was, there were maybe 2 patients in the waiting room instead of 50. Doctors are busy. They're running crazy schedules and all that. So you do have to push your doctors for solutions sometimes.
Well, and then the pain management, which has been a big part of your journey with this, and then and then also, I mean, pain management out of recovery is an entirely different thing. But for somebody in long-term recovery, finding appropriate ways to deal with the pain and not put yourself at risk. Even for me, and like substances like alcohol and drugs are not something that are a problem for me. But when I woke up from surgery and I was, a little bit groggy, and I remember somebody saying, do you want 1 oxy or 2? And I'm like, 1. And then I'm like, wait. And I'm like, oh my gosh, what if I get addicted? Because I had watched a series on oxy addiction. I'm like, you're not going to get addicted from 1.
So I need to make a statement about that as we get ready to close out the podcast, because we are in the middle of a public health crisis, and opioids right now is the flavor of the week.
Yes.
Okay. A few years ago it was methamphetamine and it was whatever. I purport that we're in a public health crisis and it's called addiction. And stop picking the flavor of the month. It's all of it. What are you doing to escape your own reality?
Yeah.
And what can we do to accept and get through our reality instead of trying to escape it? And that leads to this opioid crisis, which we're in right now. And yes, perhaps there was some over-prescribing going on. Perhaps there was some over-distribution going on. We know that happened. Opioids were given out like candy, and there was some serious problems with that. Instead of saying, here's 120 Vicodin with 2 refills, I would have gladly taken 6 pills, take 1 a day instead of 1 every 4 hours. Like they tell you, take 1 every 4 hours, here's 120. That's a 30-day supply. That could get you addicted.
Yes.
But a short-term burst of opioids is not going to get you addicted. And the reason I'm bringing this up is there needs to be a balance.
Yes.
There's got to be a balance. You can't just let people suffer in pain and not give them anything. And doctors don't know what to do. Like, what should we do? What should we do?
Yeah.
Well, give them take 1 a day for the next 6 or 7 days, and then we'll see where you're at.
Yeah, a limited prescription.
Limit the prescription. The prescribing is the part that becomes the problem. It's not the drug itself. Like if I could have 1 drink a day.
Yeah.
1 drink a day probably wouldn't kill me, but I don't have 1 drink a day. I'm addicted to alcohol.
Right.
So there needs to be a balance, though, with the opioid situation, because we tip the scales the other way now, where doctors are scared to death to prescribe anything to anybody.
Yep.
And people suffer in pain. And that leads to seeking street drugs.
Yes.
People who've been cut off of opioids switch to heroin, and it's killed them.
Yes.
I know several people that come to mind that they died because they were cut off from the addiction created by the opioids for over-prescribing and that situation. So we've got to reel this in. We've got to reel it in and be able to help people. There's got to be a balance, because then you go out and you start seeking street drugs or that fleeting thought that I had, like a bottle of tequila would help. We need to fix this. Closest I've ever, and it was just a thought.
And thank God it was just a thought. Today, once upon a time, it would have
become an obsession, and I would have been at the liquor store.
Yeah. Well, again, I commend you on your strong recovery in light of what you've been dealing with, because that just I'm definitely getting my shingles vaccine. This is not an official plug, anyone, but for me, after seeing the misery you've gone through, I'm like, if that's preventable, I'm definitely going to do what I can to not have to go through that. Because I don't know. I mean, I obviously wouldn't go to a bottle of tequila, but I think I would be a pretty miserable person to be around. I don't know if I could manage it as long as you have without escalating it with your doctor. So I'm glad he was receptive. I'm hoping this gabapentin will give you some relief until this is subsided. And I hope the next time we record that you are physically feeling 110%.
Well, thank you for the well wishes, and thank you to my brothers and sisters in recovery who, have been on this journey with me to help keep my head on straight, and to the doctors and everybody out there who work every day in the trenches to help people. Thanks to them. And thanks to our listeners for listening to another episode of the Recovery Rebirth Podcast.
Thank you, listeners.
Till next time, take care.